All right, welcome everybody. Thank you for being here today. So my name is Emma Ronaldo. I'm a clinical social worker at the Peter Gilgan Center for Women's Cancers at Women's College Hospital in Toronto, and I'll be moderating this panel today. So before we get going, just a few housekeeping items. Everyone is on listening mode during the talk. So if you have any questions, please ask them in the Q&A chat function, and we'll try to answer them as many as we can at the end of the session. If at any time you wish to leave the panel and connect to a different panel or the show and tell lounge or anything else that's going on, just please close the Zoom session and make a new selection with the sessions tab. Okay. So our topic today is breast reconstruction decision-making and the psychosocial process. Today, we will have a discussion around the realities of breast reconstruction decision-making. Deciding to have breast reconstruction or to choose not to have it is not an easy one to make. So whether you're considering prophylactic surgery or you have breast cancer, there's a process around deciding which option is best for you. And today we're going to have hopefully a fruitful discussion around that decision-making. So I'm going to introduce you to our four panelists who will offer their perspectives, both personal and professional, and provide insight around how to make a decision that feels right for you. So first is Dr. Terry Chang. Dr. Terry Chang is a social worker and a clinical researcher at the Department of Supportive Care, Princess Margaret Cancer Center. She's also a trained marital and family therapist and holds an assistant professor academic appointment at the Factor Inventosh Faculty of Social Work, University of Toronto. And her research interests include breast reconstruction, survivorship, male caregiver support groups, and online interventions. Hi, Terry. Just want to give a wave.
Oh, hi there.
We have Erin Stadola. Erin Stadola is a triple negative breast cancer survivor and a BRCA1 mutation carrier. She was diagnosed at age 29 in 2017. She's had breast reconstruction with implants, but then had them removed a year later and now has an aesthetic flat closure. Today, Erin lives in Salmon Arm, BC, works as a museum professional, and when not at work, Erin cooks, sews clothing, hikes, and spends time with her family and friends. Hi, Erin.
Hi.
We have Kat Adams. Kat is 39 years old and she has two kids, age 2 and 4. She is a BRCA2 genetic carrier from Quebec. She has a strong family history of breast cancer, including close family members. And in January 2020, Kat had a bilateral preventative mastectomy with immediate DEP reconstruction. Hi, Kat.
Hi there. Hi, everybody.
And then finally, Shawna, who hasn't joined the panel yet, hopefully soon, is a registered clinical social worker with 20 years of experience, providing psychosocial support, education, and advocacy to those with complex health needs. Over the past decade, she has worked exclusively in oncology with patients and families and has transitioned to private practice. Okay, so let's get going here. So we're going to be answering some pre-led questions, and then we'll leave some time at the end for some audience questions. So the first question is directed more towards Erin and Kat. There's an emotional process that occurs during the decision-making stage of whether to have reconstruction or not. Erin and Kat, can you both speak to your experience and what the process of decision-making was like for you? And what was the emotional impact sort of throughout and following your decision? I guess maybe Erin, if you want to kick us off.
Sure, I can do that. I guess the first decision to have the mastectomy with immediate reconstruction wasn't too much of a choice. That was my healthcare providers at the end of my cancer treatment decided, because I was a BRCA1 carrier, that would be the best option for me. So I didn't really ask too many questions. I had just been, through all my cancer treatment and kind of depleted by the end of it. So I thought, if this is what the professionals are telling me to do, that's what I'm going to do. It seemed like a good option. But it was after I went through the surgery and came out of it with implants and reconstruction, they looked great. They felt super weird. I didn't like them at all from the beginning. They felt cold to the touch. I couldn't feel the person I was hugging, which maybe seems weird, but it was like there was a bit of space in between. So that was when I started the decision-making process of, do I really want these things? Who and what am I doing this for? Because it doesn't really feel good to me. So, and I sat with that for a little bit. It was hard. Doing soul searching was hard, especially when I'd already been in the position that I had reconstruction. But having them removed and sitting with that decision to go flat and speaking with other people who had gone flat, that felt really good. And now living flat just feels great. It totally feels like the right thing for me. So, it was like a bit of an up and down and lots of emotions throughout that. But I'm really happy with my decision in the end.
Thank you. Kat?
On my end, I had the mastectomy preventatively because I'm a BRCA2 carrier. And so my decision-making process started when I was 19, right after I got the results of the genetic test. And I sat around in a sort of like a group session after speaking with a genetic counselor with a lot of other women who were also carriers. And everybody sort of went around in a room and talked about their own experiences and, what they felt like when they found out and what they did. And for me, the person that really spoke to me was a young woman who had 2 children, and she had lost her mom to metastatic breast cancer. And she said, once I had my 2 kids, once I realized I had this gene, I just had preventative double mastectomy with immediate reconstruction because that felt like the best option for me, is what she said. And she talked about, what it felt like. And I was 19 and I saw this and I was like, this makes the most sense to me. Like, this is, I guess I'm just kind of a pragmatic sort of a thinker. And I was like, oh yeah, that makes the most sense. But, I was 19 and my plan was like to have kids, to do the whole thing, and then to have the mastectomies. Well, 20 years later, that's when I had the mastectomy. And I guess in those 20 years, every birthday that would come, I would sort of feel like this is getting more and more real. And I started being regularly screened through like mammograms and MRIs at Sunnybrook in Toronto. And every year after the age of 30, I sort of felt like, okay, like I still haven't done this mastectomy thing. I'm still not pregnant. So in my case, it sort of felt like there was a race between, having babies and having a mastectomy, and sort of like, if I didn't do it fast enough, then cancer would win that race. In my family, because of our gene mutation, most people were diagnosed with breast cancer in their late 30s or early 40s. And a lot of them died of metastatic breast cancer in their early 40s. So it just felt very much like a sword hanging over me. And so, I mean, the decision, I had already made it, and I think a lot of us don't really stick to the decisions that we make when we're 19, but this one I, felt really sure about. It's just, as much as we like to plan our lives, nature has its own plans, and it took us a really long time to get pregnant. And so that was sort of an extra like emotional element on figuring out when and how I was going to do the reconstruction and the mastectomy. But once I did get pregnant the second time, once I did have my plan to have the mastectomy on my second maternity leave, I felt really good about my decision. And after speaking with Dr. Zong, who was my plastic surgeon, I felt really good about my decision. And then I had my mastectomy, and it was a great experience. I mean, obviously super painful initially, but I'm really happy with the results. I went with the DIEP kind of reconstruction, which means that it's my own tissue, and I had had 2 babies, so my stomach had some give to it and a little extra fat, and so I was able to make 2 smaller breasts out of it, and I'm thrilled with the results.
Okay, so it sounds like both of you had a sort of similar experience in that you, you know, sort of knowledge is power, right? You took time to sort of figure out what was best for you. You asked a lot of questions, and that sort of actually goes into the next question, which is around what kinds of questions. I mean, do you suggest people should be asking prior to making this kind of decision, right? It's a big decision to make. Do you have any tips, any suggestions around questions that people should be asking their providers? Maybe Kat, you want to start us off on this one?
Sure. I recommend that people ask their healthcare providers to show them images of reconstruction work that they've done on someone like them. In my case, I was a young woman, 37 at the time. I'm white, and I had DIEP. So I wanted to see somebody who looked like me, someone who was around my age, because a lot of women who get breast cancer or have mastectomies are easily in their 70s. And, you know, you want to see someone that looks like you. And I understand there's a lot of women of color who are hoping to see the same thing. They want to see what the scars are going to look like on their own skin color. They want to see someone that represents, you know, what they're going to look like. So definitely ask your healthcare team to show you different options that look like you. And then I would say that, you know, it's important to know what your priorities are and to explain them to your healthcare provider so that they can sort of help you figure out what the best way is to achieve those results. Mm-hmm. I had done some research on, you know, DIEP versus implant, and Erin, I had heard that some people felt like their breasts were cold all the time with implants, and that I didn't love that thought. I wanted my body to feel like my own body, and with DIEP, that is what I've been able to achieve. So my breasts feel like my breasts used to. They feel soft and squishy, like they used to, and warm. So I made sure when I went in to speak with my healthcare team that I made it clear, like, I want these to feel normal, not just to other people, but to myself, like when I'm in the shower and washing, that kind of thing. And, you know, it's ranking what's most important ahead of time, sort of in your own mind, because I don't know if everybody's like this, but white jacket, white coat syndrome, it's a real thing. And sometimes you get in front of a doctor and you're like, I have a million questions. And they're like, do you have any questions? And you're like, no. Right?
I always tell people it's so important to go back, right? And you can go back as many times as you want, right? Yeah. Making a decision like this, it's not just a one-off.
Mm-hmm. Yeah. So in my case, my priorities were I wanted to limit the total number of surgeries, even if it meant a longer recovery time. And so DIEP, it's a longer surgery and it's a longer recovery time, but in the end, people generally have less overall surgeries, whereas people who have implants might go back in every 5 years or 10 years or something. I really wanted my breasts to move like my own. And I wanted to go smaller and perkier. So those are my priorities. And I think it's a good idea to go in knowing what you specifically want, or so that your doctor can help you achieve those. Okay. And I have 2 other suggestions. I just don't want to take up too much time. Is that okay?
Yeah, of course.
Okay. The other thing is make a list of the activities that you do in a week, in a month, regular stuff, because you're going to want to know what you're going to be able to do and when you're not going to be able to do. A lot of the healthcare people instinctively or maybe automatically would say, like, when you're recovering, you know, you're not going to be able to pick up anything heavier than 10 pounds for 4 to 6 weeks. And that's cool. So that told me that I can't pick up, you know, my kids, who are definitely heavier than 10 pounds, but it didn't clarify, like, can I push a stroller? Like, I can't lift the stroller, but can I push the stroller? Am I going to be able to walk up the 20 stairs that it takes for me just to get to my front door? Am I going to be able to drive 30 minutes to work? Am I going to be able to, you know, all of the things that we just totally take for granted? Will I be able to raise my hands up and put my hair in a ponytail, you know, or blow dry it? How soon again can I have sex? How soon can I sleep flat on my back? Sit on the couch without pillows? You know, what I discovered in my recovery was I was creating a nest of pillows all around me. Well, I didn't know that would be the case, but it would be good to know about it in advance so that you can kind of ask these questions. And then also, like, feel empowered to ask your healthcare team about the things that worry you. For me, it was numbness. Like, when I go to the dentist, I don't like feeling my cheeks when they're numb. It freaks me out. And I was really worried that that's what my breasts were going to feel like. And spoiler alert, that's not how they feel. So I've been very pleased with that. Anyway, that's my list of questions for you to ask your healthcare team.
Okay, that's great. Any tips from you, Erin?
That's a great list, Kat. Thank you. The only thing that I would add to that, and this is more based just on my personal experience, I hope this isn't the experience of too many other folks, but make sure that you know, ask what your options are. Like we've said before, knowledge is power. Yeah, you know, going over the options, what they are, what they're going to feel like. That was a huge one as well. And, you know, Kat has gone over this. Yeah, number of surgeries, recovery. Kat said everything. She did a good job.
Great. Okay, some good tips. Thank you. Okay, so the next question is for Terry and Shawna. I see that Shawna is here. I think there were some technical issues. I don't know if she's actually here or not, but we'll start with Terry.
I'm here.
And we'll go from there. So Terry and Shawna, so you both have supported individuals who are facing sort of emotional challenges around the decision to have breast reconstruction or not, as well as sort of considering the type of reconstruction that is best for them, or flat closure. Can you provide some strategies and tools for coping with any sort of confusing feelings and emotions during this process? Maybe Terry, we'll start off with you.
Sure. Okay, thank you. I think to answer that question, I think it's already been answered by Erin and Kat. Some of the strategies that they have used to help them to make their decision. I think that first thing, foremost, I think Jigs acknowledge the fact that it is a very stressful time, and that because it's very stressful, you will experience a wide range of emotions that sometimes could be very overwhelming. And because of it's so stressful, just give yourself the time, you know, time to research, find out as much as you can, attend the broad day event, for example, right? Find out as much as you can what the options are. But at the same time, I also want to recognize that, you know, each person is different. Some women may like to do a lot of research and others may not. So I think there's a variation, but whatever that's your style, I think it's important is find out whatever information that's comfortable for you. And then of course, leading to, I think the Kat and Erin has said already, just go to your doctor prepared with questions, come up with questions. And if you have to bring somebody with you, do that. It's a little bit different under COVID, but you know, you can still have the person join in by phone, for example, and talk to other people, talk to other women, talk to your family members if that would be of help to you. And just try to reach out. And I think the important thing is really just give yourself the time. Don't feel like you have to rush into this and make a quick decision.
Mhm. Those are some good tips. Hi, Shawna.
Hi, sorry.
It's okay. It's the virtual world that we're trying to all cope with and live with. Shawna, so we're just talking about sort of you support individuals around sort of the decision making and the emotional process that comes with making a decision whether or not to have breast reconstruction or not. Terry just provided some tips around sort of strategies and tools for coping with any feelings or confusing feelings or emotions. Wondering if you have any insight around how you support people.
Yeah, I think, having access to some counseling or therapy can be really helpful, but what's even more helpful is peer support. And that's that's the spirit of Bra Day. I think initially started with, hearing people's stories in the show and tell lounge to be able to see what actual reconstruction looks like. So I think it's really important that, joining communities or groups where you have access to other women who have had reconstruction can be really, really important. I also think it's really important that women feel empowered to take pause and tell, because often reconstruction is pushed on the individual very early on, especially with a diagnosis of breast cancer. So being able to, take pause and, get the information that you need, get the support you need, give yourself grace to feel your feelings, is really important before you feel pressured into making a decision. And I think there's a feeling among the healthcare community, professionals, surgeons, oncologists, that all women want to have reconstruction. And I think that's really unfortunate, because I think that for some women, they feel much more like, Erin, for example, like themselves going flat. And so I think we need to be mindful of that and present all options to women when they're going through it. So I would say just to slow down and take your time and work your stuff out.
Can I just add that too? You talk about resources, Shawna. I think the other key thing is just to recognize, not all women have access to the kinds of services that we're talking about. If you live in a rural area or other remote areas, you may not have those services. And I guess what I encourage women to do is that ask your surgeon or whoever's going to do your surgery, ask them, is there a former patient of yours that I can talk to who had a similar surgery? Is that someone I can talk to? And I think just getting back to what Kat's point of view is that if you from a woman of a color background, you may want to see what that scar looked like, in helping you make that decision. So I would encourage women that talk to your surgeon. Maybe they can connect you with another patient for that peer support that Shawna has mentioned. They have done surgery many times before, and they do have women available, and maybe just a matter of speaking to a couple of people who will be willing to speak to the individual.
Yeah, I mean, I'm hearing sort of this general theme of just slowing everything down. I think, when we have to make a decision about something, it often feels like we have to do it very quickly. And especially, I think what Kat was talking about is that sort of white coat syndrome, is we sort of get scared or intimidated, right? And we have to make a decision, very quickly and promptly. And I think, you have the right to take time to figure out what is best for you. And I think a lot of the tips that, you're all sort of suggesting is really important, is taking that space for personal reflection and time and talking to other people as well.
Yeah, I also think having realistic expectations is really important because, again, I think reconstruction is presented as sort of the cherry on top, like getting your femininity back, moving on from your breast cancer, getting back to normal life. And I think that having a realistic expectation of what your breasts might feel like after reconstruction or might look like, or the fact that, you know, just because you had reconstruction and you now have breasts doesn't negate that you've actually had a mastectomy, whether you know, you have a BRCA gene or you've had breast cancer. So I think we need to also be mindful of that, and people need to know, have realistic expectations about what it actually means.
Yeah, that's a good point. Okay, so we're going to move along to the next part, which is has sort of two parts to the question. And the question is sort of focused around sexual identity and body image. So our cultural social norms and sort of notions of the body play a role in how we see our own bodies. And the decision to have reconstruction or not may affect sexual identity and body image, or could be influenced by some of these predisposed norms. And I'm just curious, Erin and Kat, what are your thoughts on this? Erin, if you want to start us off.
Sure. I mean, this is echoing some things that Shawna has said, but I do find it interesting and frustrating, and a room for, you know, individuals and healthcare providers to grow in that. It seems to be that it's the only, you know, one of the only times that we're asked for our input as, you know, breast cancer survivors or previvors. And that, you know, to me, leads me down this road of, you know, questioning body image and how body image is presented to us by our culture and by our healthcare providers. And I mean, for me, that was actually, you know, as much as I didn't want this, it was an opportunity for me to question that. And, you know, it brought me out on this other side of really appreciating the huge diversity of, you know, bodies and experiences, and having, just getting the opportunity to look outside what is prescribed for us. So.
On my end, I guess I had never considered going flat. I like breasts, and like I like them on other people. I liked having my own breasts. I like showing a little bit of cleavage. I think that the cultural norms that you're mentioning there, Erin, definitely played a part personally for me. I'm French. But I don't know, I guess I was raised by a woman that also showed a little bit of cleavage, and like just that very French, like, be classy about it, but you know, if you got it, flaunt it kind of thinking. I don't know. So in my mind, I never even considered going flat. And also, you're right, nobody even offered it to me. Like, it was never even a suggestion. So if that's important to you, make sure that you have that conversation with your healthcare team. But in terms of sexual identity, for me, I guess I just wanted to still feel beautiful when I looked in the mirror, and I still wanted to be seen as attractive to my husband. And I was personally quite nervous about losing my nipples. Like, I guess I didn't mention this earlier, but I decided, because I wanted to go smaller, I decided it wasn't worth having another surgery to first have like a breast reduction so that I could then keep my own nipples, because from what I understood, I would lose the sensation in my own nipples anyways. So at the end of the day, I just figured, who cares, I'll get them tattooed on later, whatever. But that like from like this is an overshare, everybody, but you know, maybe you can relate. So I'm going to go for it. But nipples in my sexual life have always been important. Like it was, you know, an exciting part of getting intimate with somebody. So I definitely mourned that even ahead of time. And I don't know if that's a self-image thing or just like a sexual, I don't know. Is that identity or image? I don't know, but it was important to me. And I definitely had a lot of feelings about it ahead of time. And I was really worried also about, you know, about my husband. Like when we're in bed together, is he going to see like Frankenstein in front of him? Sidebar, he doesn't. And I still don't even have nipple tattoos. He's just like, I don't care. Let's do this. And personally, when I look in the mirror, that it's not even that weird. Like it's a little bit like Barbie without nipples. It takes a little getting used to, but it's doesn't phase me at all now. And I'm hoping to get nipple tattoos soonish. But the pandemic kind of halted any kind of that activity for a while, and I just wasn't like the biggest priority anyways, because it turns out it didn't matter that much to me. But I think everybody's different, and it's important, I think, to consider how it's going to impact you in the future and consider all of the different, you know, feelings that you might have ahead of time.
Yeah, absolutely. I mean, Terry and Shawna, you know, you've been working in this field for a long time. What have you seen in terms of the impacts or around expectations, right? What can individuals do to help around expectations? Maybe Shawna, if you want to start us off?
Yeah, I think we need to talk about it more. I think in the 10 years that I worked in breast cancer at Rethink Breast Cancer and spoke to hundreds of women, you know, the topic of body image and sexuality and sexual pleasure, what you said, Kat, really resonated with me because, you know, people don't talk about the nipples bringing pleasure. That's not even a thing. It's like, oh, you have breast cancer or you have a risk of breast cancer. You shouldn't be concerned about your nipples. Or the fact that you're not going to derive erotic pleasure from it, or it's going to impact your sexuality because you're alive, which, you know, yes, true. But I think that for a lot of people, the impact is huge. And I think we need to be more forthcoming about it. We need to talk about it. We need oncology nurses, oncologist doctors, people in psychosocial care to like bring this to the forefront again, so people can manage their expectations and, you know, be able to talk to their partner, be able to come to terms with the fact that they're no longer going to have pleasure. And so where do you get pleasure? You know, so then that leads down this road of like reinventing your sexual self or reinventing your sense of femininity or body image. And how do you do that? Like most people are really lost when it comes to that. So I think we just need to start these conversations earlier, and we need more, you know, programming and support. And again, people need to be talking more about that.
I guess for me is probably taking a step back is to really understand what the values are of that person. I think values and expectations are in a way kind of interrelated. I'm really struck by the thoughtfulness and the reflective, the reflectivity, that's the right word, that both Erin and Kat had took the time and really thought through what the values that are important to them, you know, the body image, you know, different aspect of their body parts, how important it is to able to retain their nipples, and some of the societal expectations on them as women having two breasts and not having breasts. I think those are really important, is for women to take the time out and really reflect on those values. And I think if you give yourself the time and you have a good sense of what those values are, that will really empower you and also equip you when you go into the doctor and let them know exactly what you can expect, what you want. And I think that will turn out to be a better match in terms of type of surgery you want, and it's more important, a better match between your values and your expectations. So I think that's oftentimes the work that I do is really helping women to explore really what your values are, what are some things that are important to you. And I think through that process, I think, women, they do regain a sense of control back, and they are armed with information questions, hopefully get their answered. And that will sort of help them to be better prepared going into or making a decision. And if they decide to have reconstruction, going to the surgery. And I think that will sort of help them to have a better expectation into what they can expect. So I think some of the strategies that both Erin and Kat had talked about are exactly that, is really just take the time and be reflective and really having those discussions, Shawna was saying, those kind of difficult discussions. But I think they're also important, discussions to have.
I agree with you, Terry, but I do think it's incorrect that the onus is on the patient to really bring that to the forefront when they get a cancer diagnosis. Like, I'd like to see healthcare providers really taking a lead in bringing these issues to women. Like, I agree with you, and I do a lot of work too on, helping people to identify their values. But again, like, for women who don't have access to psychosocial oncology or a therapist or somebody who can help them through that process, it's really incumbent upon their first line providers to say, hey, you know what, like, how do you feel about your nipples? How do you feel about your breasts? What would it feel like? So I just would like, again, I think the focus is so much on, prevention or, prophylactic prevention or, survivorship through breast cancer, that we forget that these things have a lifelong impact. And so I would love to see that onus not being on the patient to have to scramble to figure that out,
Yeah. And I think, Shawna, I think that's very valid. And I absolutely agree with you. But we also, the reality is, when you get into a clinic, some of those conversations don't happen. And unfortunately, some of that responsibility do fall onto the woman. And especially when you're dealing with women who maybe English is not their second language, coming from a more conservative or collective culture, well, that conversation never ever comes up at all. Right? So I think that I think that would be terrific, that if physicians will take that on. And we know that not all women are information seekers as well, right? Some women will not go out and search on the internet for information. So I think there's a really variation that happen. Yeah. But absolutely.
And that's why, and I think, in clinic, if they're not able to have those conversations, that's when it's so useful to refer to organizations like, Rethink or,
absolutely,
or whatever the breast cancer organization is that's local, because that's really where they're going to get, that information.
Yeah, absolutely.
Yeah, and I think speaking of supports, that goes into sort of the last question around, if individuals want to access supports, where can they find them? What should they be looking for? And I think we have actually a couple questions that are asking about supports in terms of, financial supports and where to find resources. So maybe if the two of you or anyone can really sort of speak to that around what they have found in their experience.
Yeah, I think, there's great organizations, Rethink Breast Cancer is sort of the young women's organization. It's good. CBCN is, a national organization. Nanny Angel Network provides care. There's, who am I missing? There's
Canadian Cancer Society.
Canadian Cancer Society,
Wellspring,
Wellspring,
depending on where you live,
psychosocial oncology in your hospital if you're lucky. That's not always the case in community hospitals. Finding a therapist in the community who's well-versed in chronic illness can be really useful, or oncology. Peer support through those organizations. I don't know.
Maybe I could put in a plug for social work. There usually are social workers based out of a hospital. And I mean, they are sort of viewed as the gatekeepers in terms of resources in the community. So, and oftentimes, you know, you do not need a medical referral to see a social worker. So I would suggest that is that just ask your doctors, nurses for, you know, is there a social worker in the hospital that I can speak to? Maybe that's a starting point. But there are, you know, wonderful programs, you know, depending on where you live. Certainly the Canadian Cancer Society, the Peer Connection, you know, the Rethink. We work very closely with these organizations. Excuse me. And there's a wealth of information out there. But I think the key point is sometimes is making that first initial connection, and not a lot of individuals are aware of those resources out there, unless, you know, they proactive and go on internet and search them.
Yeah. And I would suggest even asking your healthcare provider, you know, what supports are available.
Yeah.
I know, like, there's some questions here asking about sort of coverage, breast reconstruction coverage, and, you know, your hospital will know the answers to those questions. So, you know, I would suggest sort of linking with your healthcare provider if you're unsure about something, and if they don't know the answer, then they'll, you know, hopefully try to redirect you to somebody else. Okay, so we are coming to the end. We have time for probably one question, and then if there's other questions, then I'll let you know how you can submit your questions and hopefully get an answer at some point through a forum. So the question here is about someone is considering going flat. They're very active and struggling with the idea of reconstruction or wearing a prosthesis, and sort of, I guess, that transition. Any tips from anyone?
I'll just jump in here. This person had a second part to their question that I answered in the chat, which was, you know, overcoming the emotional roller coaster that comes with this. And I suggested to this person something that really helped me, which was peer groups, talking to, like, I found some amazing Facebook groups to connect with other people who choose to live flat. And it was so helpful in my decision-making process in the first place to hear from women who live this way. And also throughout, I mean, I still talk to them and get a lot of support from them.
Great.
Me too. Can I just say the online Facebook groups were very wildly helpful to me in preparing for my mastectomy. Just getting their input on what recovery really felt like, all those questions that we probably are too shy to ask the doctor. We asked these random women on these Facebook groups, and a lot of people very generously shared images of before, right after, 2 months later, 10 months later, and that really helped mentally prepare me for recovery.
Great. I'm going to squeeze in one more question. It's difficult to make a decision. What if I regret my decision or change my mind? Who wants to take that one?
That's a great question. I do know personally of a few people who have regretted their reconstruction. And you have the right to change your mind. So you go to your surgeon and you advocate and you say, you know, I've changed my mind, and you be prepared to go through another surgery. And you you do what you need to do to put that into place. I think culturally, as Canadians, we feel very sheepish about asking our healthcare providers for things that feel outside the scope of practice. But at the end of the day, it's your body and your choice, and you have to live with whatever you choose to do. So if you're not comfortable with it, you need to speak up and get something done about it. Erin, you're probably better to speak to this.
Yeah, I mean, I did regret going through with implants. Luckily, I was able to have them removed. It wasn't easy to have them removed just because they were already in there, and different surgeons I would go to would say things like, "You're too young," or you know, "You have such a great result. Why would you want?" So anyways, what I'm saying is there was some pushback. But yeah, I mean, if you really regret your decision, are you just gonna, you know, don't stick that out. You don't have to. I mean, in some cases, you know, there are things that are medically possible and medically less possible, but you don't know until you ask.
Good tips. Okay, that's all we have time for today. So I just wanted to sum up. Breast reconstruction is a deeply personal choice. There's no right or wrong choice. And what we know is that information seeking, asking questions, accessing support, and personal reflection, and I'm going to add sort of slowing down, are really important pieces to making a decision that's true to your values and preferences. So I want to thank Kat and Erin for sharing intimate details and for being so honest and forthcoming about their experience, and to Terry and Shawna for providing insight into the psychosocial experience of breast reconstruction decision-making, as well as providing information for resources and support. If you still have questions that were not answered in this forum, I'm just going to share my screen here. Please reach out to Cancer Information Hotline. Helpline, and they'll be able to sort of direct you if you have a specific question on finding an answer. So here's, you can take a screenshot of that or a picture. And if you have any questions, feel free to reach out. And that is all for today. Thank you everybody for joining.